Good morning, everyone. Welcome to Gender Expresso. I'm Zara, your host and barista. Today, we're going to talk about labiaplasty. It is the second stage of transfeminine, feminine non-binary bottom surgery. This procedure is offered to patients approximately 5 months after undergoing a vaginoplasty or a vulvaplasty, but it is also open to patients who have had all-in-one or single-stage only techniques. There's a wide variation of the appearance of vulvas in the natural world, and ultimately, my goal is to allow my patients to have the adequate features so that they fit well within the realm of the natural world. The goal of labiaplasty is to create a vulva that matches the natural result as best as possible. I'm not going to tell you that after the second stage that everything's fine and perfect. This is very complex surgery, and so sometimes revisions are needed to redefine features of the clitoral hood or labia minora, or even take up even extra skin from the labia majora, and that is okay. I'm certainly not the only person that takes a two-stage approach, but there are other single-stage surgeons that do offer revisions because they recognize that some of the features tend to blunt over time. And it's not everybody, not my patients, not their patients, but for those who need it, we offer the right support and help them with a revision to make things better. The main features I try to focus on are creation of the clitoral column, clitoral hood, and full labia minora. Aside from that, it is also a second chance to try to make anything and everything else better. This includes symmetry of the labia majora, any type of skin laxity gets taken up because that's the tissue that I use to create the labia minora. Functional aspects are also taken care of, such as scarring around the entrance of the vagina or issues with the urethra. This surgery is done under general anesthetic on an outpatient basis. Recovery is relatively minor compared to the first stage, vaginoplasty or vulvaplasty, because there are a lot of deep structures that get reconstructed in that particular surgery. This is more surface work, but to say that it's easy in terms of recovery is not really true. It still hurts. Like any surgery, swelling is an issue, and the labia minora are quite prone to it. So after creating the labia minora, which I make as large as possible given someone's anatomy and availability of skin and tissue, they tend to end up being like paddles, quite kind of fat and stiff. But over time, as it heals, it does soften up and feel quite natural. The clitoral hood and column do swell, but it does soften over time. Surgical risks for this procedure are swelling and bleeding. Bleeding can present as a hematoma, which is a blood collection, or simply really bad bruising, which is more benign. It is very rare to have to go back to surgery to control bleeding or to evacuate a large hematoma. I think that the worst complication is loss of the labia minora. This can present in different ways, from partial loss of the labia minora definition to possibly complete loss. Should complete loss of the labia minora occur, it should be left to heal and then come back many months later to try to reconstruct the labia minora and still end up with adequate but smaller labia minora. So there you have it. These are the main points about labiaplasty, and you should consult with your surgeon and ask questions about how to make things better through a labiaplasty. Good day, my queers. Be wonderful, and I'll see you at the next video.